Family support is very, very important. Family and friend support to ensure to improve. So when you cannot save the woman's skin, when you're removing the breast, what we do is breast. Now, cancer of the breast, until it actually spreads, it may not really affect their weight per se, because like I mentioned, after they finish their entire breast cancer treatment, including radiation, maybe a year or two later, if they feel that, oh, I don't like this, I want to have a breast, then we can do it.
Dr. Manjula Rao, so today, in the last 12 years that you've been working in the breast cancer, the space, what are the advancements that you observe?
Breast cancer, breast oncology is a field which is changing rapidly. We're learning new things every day. We have these oncology conferences happening many times a year internationally, where there are new results of new studies constantly coming in. Now, I can tell you, when it comes to, for example, surgery, right? There has been a drastic shift from very radical methods of surgery where the whole breast was removed, underlying muscles, everything was removed. So, very bad quality of life. And we're moving towards saving, like, conservation, as we call it, in the medical language. So, from mastectomy or removal of the breast, we move to conservation. And then when we move to breast conservation, we realize that yes, but when you're taking the lump, there's still a defect in the breast, and cosmetically it looks bad. So then from there, we have moved towards breast conservation but improving the cosmesis. So by using a technique called Oncoplasty. And then women who still need to have their breasts removed, we are offering breast reconstruction. So from a surgical point of view, things are changing very rapidly towards conservation. And in the previous episode, we spoke about axillary nodal clearance and lymphedema. So even when it comes to axillary staging and axillary surgery, we are moving towards conservation. So, sentinel lymph node biopsy, and we're also identifying that select population with very good biology disease, a very low grade disease, where we can maybe try and avoid an axillary, a sentinel node biopsy as well. So, moving towards getting best outcomes by doing as less as possible. That is in breast cancer surgery. Chemotherapy, everything is about identifying the behavior of the cancer. What is the biology? What are the targets? And we give specific treatments. We target the, what is actually causing it. So there is hormonal therapy, there is HER2 directed, targeted therapy, you have immunotherapy, you have something called CDK4/6 inhibitors. So, a lot of changes. And even in radiation therapy, if you see, earlier the techniques were very crude. Now we'd see how to get the best optimal outcomes by delivering radiation. So earlier it used to be like 40 days, but now it's 21 days. Now we do then 21 days, and now we're doing it for 15 days. And now we have like a fast forward regimen or fast regimen as well, where we deliver radiation in 5 days. Okay, and then also the kind of radiation, the technology has improved. So where I work at the Apollo Proton Cancer Center, we have the proton therapy machine. So that was the first, I'm very proud to say, we're actually the first center in the whole of India and South Asia to, have a proton therapy machine. So how is proton radiation different from conventional radiation? It is more focused. So if you have to hit a target, it hits the target and only targets that area. There is no spillover to surrounding structures. So your side effects or the complications definitely come down. So as you can see, a lot of developments.
Doctor, the breast reconstruction, is it similar to the best breast augmentation, the silicone which women use for, cosmetic purpose? Is it similar to
Yeah.
that?
Yes and no. So when we talk about breast reconstruction, there are two ways to do it. One is immediate, right? Immediate, and also one is skin sparing and one is without sparing the skin. So when you cannot save the woman's skin, when you're removing the breast, what we do is breast reconstruction using autologous. So autologous is using the woman's body tissue. So we take extra fat and skin from her abdomen or buttocks or thighs, and we use it to recreate a breast. That is autologous reconstruction. The other option is to use a silicone implant to reconstruct the breast. Now, for that, it is imperative that we have a skin cover. So, when we do a skin sparing mastectomy, where we remove the breast tissue but we save the skin, we do have the option of filling the space or the gap with an implant. Now, whether to do an immediate reconstruction or a delayed. So, what is a delayed reconstruction? After they finish their entire breast cancer treatment, including radiation, maybe a year or two later, if they feel that, oh, I don't like this, I want to have a breast, then we can do a delayed reconstruction. But for that, we recommend autologous breast reconstruction. Now, whether to choose immediate or delayed, whether to choose implant based or autologous, that is a discussion that they must have with their doctor and their also the plastic surgeon, because that depends on what kind of disease they have. What are the patient's habitus, the body type, what is the work that they do, what is their lifestyle. We keep all that in mind and we take a decision.
So these procedures, these cosmetic procedures, do they have a lifespan? Like every 10 years you have to redo it, or like a tattoo, you have to refill the color. Is there something like that?
I would not call these cosmetic procedures, and that is why, because they call cosmetic procedures, and the the insurance companies don't reimburse these patients for the procedures, and that is something that is a cause of worry. Because look, when somebody undergoes a hand amputation, you reconstruct it, isn't it? So breast is not a redundant organ. It contributes to a woman's psychosocial health, her mental health, her body image, her confidence, her sexual health, everything. So after breast cancer treatment, breast reconstruction is not a cosmetic procedure at all. It is something that is required for the woman to ensure a good quality of life, right? That is one. And now, what is it that you asked me? Like, do they have to repeat it, right? So now, if it's an autologous reconstruction, they don't have to repeat it, because
So the
your
blood flow and all is established normally,
it
like
has
a
to,
normal
yes,
tissue.
yes. So, what is an autologous reconstruction? Like, say, the gold standard is using the tissue from the abdomen. So, you take out the fat and the skin from the abdomen. Once you take it out, it's dead. No, it's dead tissue, because you're cutting off the blood supply. But we leave an artery and a vein there. And then it is brought to the chest area and it is connected to a vessel over there to give it life. And it's not something that we see over months. Immediately, it has to function. The next couple of days or the next week is very crucial, where we monitor the patient and see whether the flap has taken up or not. So, an autologous reconstruction, what can happen is, in case they have to undergo radiation, or with time, a portion, sometimes there can be something called a fat necrosis, or the volume of it can come down. There are ways to match it to the opposite breast, and some women, they also get, we can recreate a nipple, and then they get that area tattooed to kind of give it, there's 3D tattoos available to give it the impression of a natural nipple and an areola. Now, implant based breast reconstruction is a bit challenging. While it's very easy to put in the implant, there are a lot of factors, because it's something artificial, isn't it? So sometimes radiation can affect it, and sometimes, the implant itself. Depending on the patient and what treatment they've undergone, their lifestyle, it may have to be replaced. Typically once in 10 years, but otherwise, even before that, based on whatever treatment they've received, sometimes once a year, once in 2 years as well. We have a lot of patients who've undergone breast reconstruction. I usually recommend autologous breast reconstruction, and and it has really helped them a lot.
What is it that you recommend for your patients when they embark on this journey in terms of diet? And also, if we can touch about, how do the patients need the family ecosystem to be supportive, and the support system? Like, what is it that you recommend for them for their mental makeup?
Family support is very, very important. Family and friend support to ensure, to improve their confidence, to give them hope, and to ensure compliance to treatment. But more so, one should also look after the health of the family. You know, while we always focus on the patients, we do not realize, we fail to realize that this can also have profound uh, it can negatively impact the mental health of the family members, be it the husband, the boyfriend, the fiance, the parents, or the children as well. So it is important that they seek the necessary help for their mental health. So it's about supporting one another. Now, what was the first thing that you
The
asked me?
diet, what is it
Yeah.
that you usually tell
So
your
the diet, now we recommend that they continue to have, you know, what they're having, no do's and don'ts per se, but we do encourage that they have a fiber rich diet and diet that is rich in proteins to give them the energy. So we recommend that they have eggs, we recommend that they have protein powder, but doesn't mean that they overdo, because it's important that they don't put on weight as well. Now cancers, right now, there are two different kinds. There are cancers of the internal system like the stomach, etc., where they end up losing a lot of weight. Now cancer of the breast, until it actually spreads, it may not really affect their weight per se, because in fact, like I mentioned, obesity is one of the main causes for breast cancer. So it is important that while they eat nutritious food, fiber rich food, protein rich food, the calories are also kept in mind. So we recommend that they see a dietitian so that they do not overeat or also lose a lot of weight during treatment. And for the family support and for the patient support as well, we do recommend psychological
are
counseling.
there support groups here which help patients, where people can go and talk to patients who have already overcome?
Very much so. There are a few in the city. In fact, we have started one. I have started one at my hospital as well, which I
What is
call
the name of it?
ABCD. It's called Apollo Breast Cancer Diaries. So we started it 2 years or 2.5 years ago. At my hospital, where my patients have this forum to sort of interact. So we, you know, while we started it and we curated, it was a lot of fun. We had all of them come with their families and we curated programs for them. While it looks like a lot of fun singing and dancing, there was a reason we curated them. So we would have exercise sessions like yoga. We took them to the beach once, organized a yoga session to introduce them to the beneficial effects of yoga, pranayam, etc., on their quality of life for those undergoing treatment as well as after treatment. Then the first support group, I remember I had organized a strength training session to show our women. Strength training is very important to maintain bone density, and so to show our women that they don't need to wear like fancy athletic gym gear. They don't have to go to the gym to do strength training. So we taught them how to do basic maneuvers to exercise their muscle groups just by using props at home, using weights at home, like using 1 liter water bottle and things like that. We organized art therapy sessions, singing sessions, dancing sessions to help their mental health. And then we would give them talks as well. But while my team and I, as doctors, we started it. It's very important that the continuity is kept going by the patients themselves. So we need the patients then who are motivated to take the leadership, because it's their support group. It is for them. They need to tell us what is affecting them, and we will help them with the tools to improve their lifestyle or to help solve their concerns. So it is a group that they need to keep going as well.
Amazing, doctor. I mean, your work towards supporting patients who and the families, it's really remarkable, and I really hope that people watching this are able to share this episode with their near and dear ones who might be undergoing this. I'm sure it's going to be useful for so many people. And
Absolutely. Thank you
thank you
so
so
much.
much for being here.
No, thank you. Thank you for having me.